Can a reused syringe become a public health problem? Can a tiny needle stick create real medical risk? The answer is yes. In 2008, about 40,000 patients in Nevada were notified that they may have been exposed to hepatitis C and other bloodborne pathogens. The issue was not a rare disease. Investigators found unsafe injection practices at an endoscopy clinic, including syringes being reused to draw medication from vials used for multiple patients. That is where bloodborne pathogen safety becomes real. Exposure risk does not always start with a dramatic emergency. It often starts with one unclear step: a syringe reused, a sharp carried too far, a sharp container overfilled, a blood spill cleaned without proper PPE, a contaminated item treated like normal trash, or a worker unsure what to do next.
The CDC estimates that about 385,000 needle sticks and other sharps-related injuries happen every year among hospital-based healthcare personnel in the United States. OSHA also notes that as many as 1/3 of sharps injuries in hospitals happen during sharps disposal. And the CDC estimates that 62% to 88% of sharps injuries can be prevented by using safer medical devices. So the real question is not only, what should workers do after exposure? The better question is, how can workplaces stop exposure before it happens? First, identify risky tasks. Bloodborne pathogen exposure can happen during injections, blood draws, dental procedures, lab work, first aid, cleaning rooms, handling laundry, disposing of trash, cleaning blood spills, or working in home healthcare. Second, control sharps at the point of use. Sharps containers should be close, visible, and not overfilled. Used needles should go into the container immediately. They should not be left on trays, carried across rooms, or thrown into regular trash.
Third, use safer equipment whenever possible. Needleless systems, self-sheathing needles, safer scalpels, and proper sharps containers reduce the chance of direct contact with contaminated sharps. Fourth, match PPE to the real task. Gloves may be enough for some tasks, but if splashing is possible, workers may need eye protection, face protection, masks, gowns, or other protective clothing. The question should be simple: what could touch the worker during this task? Fifth, make the exposure control plan practical. A written plan only works if workers understand it. They need to know where PPE is stored, where sharps containers are located, how contaminated materials are labeled, how spills are cleaned, who to report to, and what happens after exposure. Sixth, train people before pressure hits. During an incident, unclear instructions fail. Workers need simple rules they can remember. Do not recap needles by hand unless an approved procedure allows it. Do not pick up contaminated broken items with bare hands. Do not clean blood spills without PPE. Do not put sharps in regular trash. Do not wait to report exposure.
And seventh, make reporting immediate. If a worker gets a needle stick, a cut from a contaminated sharp, or blood splashed into the eyes, nose, or mouth, they should report it right away. Not later, not after the shift, not only if it looks serious. Fast reporting matters because medical evaluation, testing, documentation, and follow-up may be needed. Bloodborne pathogen prevention is not just a safety rule. It is a workplace workflow. Find the risky task, use safer equipment, keep disposal containers where the risk happens, wear the right PPE before contact, train workers in plain language, report exposure immediately. That is how workplaces stop bloodborne pathogen exposure before one small mistake becomes someone's health problem.